When cancer treatments end, many patients feel that their lives will go back to normal fairly quickly, but that's not always the case. And it can be frustrating when your side effects linger longer than you expect. The most common long-term physical side effects among cancer survivors are fatigue, chemobrain, lymphedema, peripheral neuropathy, and aches and pains in the muscles and joints. All of these can be treated either by your medical team or with good self-care. Emotional responses are common too. Many people feel anxious, sad, stressed, or a little bit lost after their active care is over. Time helps, and so does talking to somebody about it.
You take the opportunity after what you've been through to kind of reassess your whole life in general.
Your mind's been through a lot when you go through the process of treatments and all of that was involved with those, and then afterwards, and then scanxiety, and then is this really working or not? And it just a lot of things build, and too many things going through your mind, and so you do become forgetful.
You've been through many months of intense challenges through this cancer treatment. Your body has changed, you've had a lot of emotions, you've had stresses on your finances and your daily life. You and your friends and family have been through a lot. And you may be at this time thinking, yay, I'm almost done with cancer treatment. But the reality may be very different.
A lot of times managing your symptoms can be dependent on how well you're taking care of yourself. And you'll read this and you'll hear this, if not from your doctor, but from some of your other caregivers or care helpers, is that rest is so important. And the one thing I would really recommend is just really get on top of a super good, super healthy diet. Many of us sort of undervalue. We go back to eating the same kinds of foods. Maybe those are what we're comfortable eating, or those are what we know how to cook. But sometimes this demands really kind of an overhaul of your nutrition and your diet experience.
Cancer is a life-altering experience, and recovery takes time. There are several things you can do to feel better, faster. Be gentle with yourself and understand that all of this is a normal part of recovery. Do what you can to be good to your body. Eat healthy foods in moderate portions and get some exercise every day. Make time to feed your spirit with the things that enrich you. Talk to people who understand what you've been through, such as a survivor support group or an oncology social worker. Give yourself time to process what you've been through and to allow the physical effects of your treatment to wear off. And don't let anything discourage you from living every day the best way that you can.
I learned that, possibly I can be the answer to my own cancer by being empowered and engaged and asking all the questions I need to ask and seeking out the information I need.
Yeah, one thing that really keeps me motivated to fight through this cancer is my grandchildren. They would ask me about being sick and about my hair being gone and all that. And then they would hug me and tell me how much they loved me and said I was still beautiful.
After being cancer-free for 13 years, I feel pretty good, pretty hopeful, pretty excited about living. I think my mantra is I just take the day as it's given to me and live day by day and kind of make the most of each day that's given to me.
As I continue my journey in my life, I realize that sometimes we win and sometimes we learn. Cancer has been a great teacher for me, and I hope it is for you.
You've been diagnosed with a serious disease, and you've lived to talk about it. That's a pretty powerful statement. Remembering that will give you the strength that you didn't know that you had.